Dr. Whitney Cope of Audiology and Hearing Center, our guest on this portion of Family Health Experts, answering your hearing-related questions at 1-888-208-6946. We have a question from Janice, who says, I recently had a hearing screening, but a friend of mine said I need to come see you and have a hearing test. What is the difference?
So the main difference between a hearing screening and a full diagnostic evaluation is the depth of the testing that we do. So for a screening, it's more just a pass or a fail. You don't get a lot of information from that hearing test. So if you fail or you question the reliability or anything of it, we definitely recommend getting a full test to get all of the information that we need.
Someone says my dad has had his hearing aids for 5 years now. However, I'm not convinced he's hearing as well as he once did when he first got them. How often should you change hearing aids?
That's a question we get a lot. So the average life of hearing aids is about 5 years. So I would definitely recommend going in for an updated evaluation and looking at the updates in technology. I mean, it's like any technology, computers, cell phones. I mean, think about the changes they make over 5 years. So usually 5 to 6 years is the life.
Next question comes from someone who says, I feel like I only have hearing loss in my right ear. Can I get just one hearing aid for that ear?
Sure. We have people who wear one hearing aid all of the time. It's, it's ear specific, so just depends on the hearing in each ear, but you can definitely just get one hearing aid.
Next question comes from Rhonda, who wants to know, how will I know if the hearing aid I get is actually right for me? And I guess there is a lot of difference in hearing aids.
There's a lot. Don't Google hearing aids. There's too much on the internet, and that's part of, where you should rely on your provider and their professional, opinion. As a provider, we kind of just pick a few manufacturers and work with them because all of their software is different, their apps are different, their programmers, all of that is different. And so, there are a number of reasons why a provider might pick one manufacturer over the other, but there's a lot of thought that goes into it, and you could just ask your provider why they chose what they chose for you.
Have about 45 seconds left, and someone wants to know, is there a cure for tinnitus or tinnitus?
So depending the cause of the tinnitus or the tinnitus, there's generally not a cure for it. Most often it's due to nerve damage, and that's a permanent type situation, so there is no cure or anything for that. It's generally permanent. There are management options that we have available.
Well, coming up at 12:30, that's roughly 11 minutes from now, there will be a full half hour featuring Audiology and Hearing Center. It's called Hearing Solutions, so if you didn't get your question in, chances are it may be answered within that 30-minute program, so I invite you to stay tuned for that. Meanwhile, if you'd like to review this segment, you can do so shortly online. Look under Family Health at WPSD Local6.com.